The acting health minister, Mamoloko Kubayi-Ngubane, has announced the registration date for over 50s, but she's expressed concern about the lack of registration of the over 60s. She was briefing the media earlier on about the national vaccine rollout program. Let's speak to eNCA's Heidi Jokos, who's been tracking that particular process diligently. Heidi, good news. We start with this over the other phases of the vaccine rollout that they will soon be opening up.
Yes, certainly, Tulas. I think it is some good news given the pressure that government is under to vaccinate as many people as possible. We do know that over 2.5 million people have been vaccinated to date, and we know that the vaccine rollout started in about mid-Feb, so it's taken them a couple of months to reach this particular point, but it seems as though the vaccine rollout is ramping up. We know that those that are 50 and above will be able to register as of the 1st of July, but will only be able to start getting vaccinated as of the 15th of July. Now, many would ask, why is there this 2-week gap before they actually get the vaccine from the date that they've registered? But we do know that we need to wait for vaccines to arrive. We need to make sure that those that have registered are eligible to get the vaccine, and they fall into the category of 50 and above. And it's a very long admin process that needs to happen behind the scenes before people can actually get to the vaccination sites. But it is some good news that other phases and other sectors are officially and finally opening up. But let's listen to the Acting Minister of Health on this matter.
From the 1st of July 2021, we will open registrations for all citizens which are between the ages of 50 years and above. And we will also schedule those vaccinations to begin on the 15th of July. I encourage all the citizens to register and get their vaccine. If you have a friend, a family member, a neighbor, or a loved one who is at 60 years and above, especially as senior citizens who are battling to get a move around in terms of mobility, please bring them along in terms of your vaccination centers so that you can help them. And we are hoping that in the families, this will encourage all of us to take our parents, our grandparents, our loved ones as we go to the vaccination sites.
So that has to do with the opening up for people who are over the age of 50, between 50 and 59. But Heidi, as much as we're saying that opening up is good news, there's a bit of concern about those who are 60 years old and above, that they're not getting to vaccination sites.
Yes, certainly, and I think this is a big concern for government, as the goal and deadline was to vaccinate 5.5 million people by the end of June that fall into the category of 60 and above. It seems as though registrations are quite low, and turn-up of those that are 60 and above is also significantly lower than what expected. We do know, however, that the department says this is why they are opening up to other phases, so they do not wait for those 5.5 million people to be vaccinated in 60 and above. What's also interesting here, Tulas, is the fact that many thought that those that were in rural or remote areas would not register or not get to vaccination sites. But if you take, for example, Limpopo and parts of rural KZN, the number of vaccinations administered is reasonably higher than anticipated. But in Gauteng, it seems as though the number is very low than what the Department of Health had anticipated. Let's listen to the department on this once again.
So far, Pfizer has delivered nearly 4.5 million doses as promised in Q2. They have also committed just over 15.5 million doses in Q3, of which we are expecting nearly 2.1 million doses in July. Johnson & Johnson have so far delivered 500,000 early access doses used for Sisonke, 300 market doses last week, and 1.2 million doses landed last night in the afternoon, ladies and gentlemen. These doses all need to be used by 11 of August, and I think we are on track in terms of working to ensure that we utilize these doses. But we are waiting confirmation for delivery of 500 doses, and this then will make up 2 million to replace those that were affected in terms of the contamination that we announced last time. With this flow of vaccine, we will be able to press ahead with the vaccination of frontline workers, sector by sector, and I do want to confirm that we will then move on to workplace vaccination, both formal and informal sectors like the taxi industry. We will take guidance from the IMC on COVID-19, together with the MEC, on which of the sectors to prioritize, and moving along until all work-based vaccination are completed.
So what you're seeing there, Tulas, is the Acting Minister of Health, Mamoloko Kubayi-Ngubane, explaining how many vaccines are currently in the country and how many more are expected. So the vaccines are coming, they are here, and this speaks to how government is planning to roll out more phases, and they are going to run concurrently. And just looking at the deadline of expiry dates, many shouldn't panic about that, because we do know Pfizer did say they can extend the expiry dates on those vaccines, but this is even more pressure for government to try and get as many people as vaccinated as possible, and hopefully in the next coming weeks we'll see more sectors and more categories opening up.
Yeah. Lots of numbers being thrown about. Thank you for that. eNCA's Heidi Jokos, you can count on her keeping track of those numbers of the vaccines that have already arrived, the vaccines that we are expecting, and we know that institutions like SAPRA, the Health Products Regulatory Authority, are talking about 3 more vaccine candidates, vaccines actually, that they are, assessing at the moment for possible approval for use in South Africa.